Hello, everyone. My name is Ahmed Masri, and I'm the director of the Hypertrophic Cardiomyopathy Center at the Oregon Health and Science University in Portland, Oregon. As many of you are aware, we are an HCMA Center of Excellence. I want to take this opportunity to thank the HCMA, Lisa Sahlberg, and her team for dedicating all their time to furthering the care of patients with HCM and raising awareness for HCM. This is also a good time to share with you some updates about our program. First, I want to remind you that while sometimes we view physicians as the face of some of these programs, really there is a very complex, large, multidisciplinary team that is taking care of you day in, day out. And some of them work in the shadows, others you get to meet and talk to. And I wanted to give you some clinical updates. First of all, that to remind you that we do have a dedicated HCM clinic that runs on Tuesday and Wednesday of almost every week. And some of you met myself as well as some of my colleagues, Ms. Kelly Graham, who's a nurse practitioner, spent many years taking care of patients with HCM, both on the research and the clinical side, as well as I'm happy to announce that Dr. Ben Levin, who is an experienced cardiologist and a cardiac MRI specialist, has joined us from the University of Illinois in Chicago. And many of you will get to meet him over the next couple of months and year. We also have a dedicated cardiac genetic counselor, Ms. Erica Jackson, who runs a dedicated clinic as part of our program and offers many days during the week for in-person as well as virtual visits to provide the best care possible to you and your family members. Our program continues to deliver all pathways of treatment for hypertrophic cardiomyopathy, from first-line medications to more specialized care, such as septal myectomy. Dr. Howard Song is our myectomy surgeon who's experienced and spent many years performing septal myectomy in Portland, as well as serving the Pacific Northwest community. Also, we do alcohol septal ablation when appropriate. Dr. Joaquin Seguroa helps us achieve excellent outcomes with this procedure as well. And we do perform complex electrophysiological interventions as well as transplant when and if needed. We also have a long history really utilizing novel therapies such as mavacamten, initially on the research side. Many of you have participated in this trial, and thanks to you, these trials have been successful, providing a new treatment options for patients with HCM, obstructive HCM at this point in time. And mavacamten, as many of you are aware, is commercially available at this point. And we have our dedicated pharmacist, Dr. Hongye Chen, who helps us deliver the best care possible to you, our patients, by ensuring that we can secure mavacamten for you, as well as a smooth sailing in this complicated process. It's always a complicated process when it comes to specialty medications. And you also interact with our fantastic program coordinator, Ms. Tanya Davlon, who spends a lot of her time ensuring that you have a really good experience when you visit us, as well as if there are other imaging tests, as well as other appointments that need to be lined up for you, we try to have that itinerary for you so that we minimize the number of trips you come to the site with. And then finally, our fantastic nurse coordinator and manager, Katie Fisher, who spends most of her time taking care of patients with HCM and their families, and many of you have met her throughout the years. On the research side, many things are happening, and many of you are aware of our dedication to furthering the care of patients with HCM. That happens through generating more evidence and studying the disease process, as well as studying the new therapeutics that are coming down the pipeline in this space. Hundreds of you have already participated in our tissue, blood, and urine biobank and registry. And thanks to you, many studies are now being conducted that would help us understand the natural history of the disease, why and how when this disease happens, the severity of it, and why some people develop it while others don't, even though they might have predisposition for the disease. We also continue to do imaging research with echocardiography, cardiac MRI, and our newly acquired PET MR machine, where we are combining both MRI as well as nuclear techniques to study disease processes at a deeper molecular level. We are very active, and that's primarily really, truly thanks to you, our patients, who devote their time and effort in participating in clinical trials. Over the years, our program has grown tremendously, and with that, we also have grown in our commitment to improving delivery of different therapeutics under investigation to patients with HCM. That started many years ago with mavacamten, and now we continue with aficamten as well as other medications in the pipeline, including energy modulators and what you will hear about soon, which are gene therapy programs that are being developed as well. And so we are also hoping in the next year or so that we go back to hosting you in person. These meetings typically are focused on patient education and awareness, as well as creating a community for our patients. And then we also try to invite providers and physicians who take care of HCM patients so that we can further the care of everyone in our community across the beautiful Pacific Northwest. I want to wrap this up by thanking all of you for making us better and for moving the field forward, and for the HCMA who continues to advocate for you, us, and raising awareness for HCM. Thank you from the OHSU team, and please do not hesitate to contact me or any of us here at OHSU if you have any follow-up questions. Thank you.